Brother and sister, it's my honor able to use this opportunity to share with you some of the things we do. We try to reverse some of the chronic illnesses in the pandemic. We know that COVID-19 have disturbed all our life. Okay. Not only that, we also know that there are many risk factors that increase the death rate of COVID-19. Start from hyperpressure, diabetes, heart problems, kidney problems, or even high cholesterol. And very unfortunately, Malaysia is a heaven for good food. We also have 50% of adults in Malaysia is overweight, 40% about high cholesterol, 30% hypertension, and almost 20% is diabetes. Ngam, all matching. So what is this, all this disease? If we can group them all, I think everybody agree this is a lifestyle diseases. That means it's lifestyle related. So when we talk about lifestyle related, what do you think? What is the first line of treatment for lifestyle illnesses? What do you think? Of course, we all know the first line of treatment is still lifestyle modification, okay, before we go to the medicine. But when we go to lifestyle modification, we always ask one question: how much did we learn from medical school? How much do we know about lifestyle modification? Sleep well, don't overeat, less oil, less sugar, less salt, okay? And, well, exercise, reduce your stress. But I think if you ask anybody outside a layman people, they give the same answer, right? They give the same answer. That's why I still remember when I was in medical school, my question is lifestyle and diet modification. Lifestyle and diet modification. That's all, one line. Then the rest of the line, right, what method I give, Because I didn't learn much about lifestyle modification. Is it really important or not? How much we emphasize in lifestyle modification? Or the most important, does it really work or not actually? And is it sustainable? Some people say, lifestyle of course is good. It's not able to sustain one. Is it sustainable or not? So I'll give you an example in diabetes, in diabetes. In the American College of Lifestyle Medicine, actually, they have come up with an expert consensus statement. Okay? And this expert consensus statement is endorsed by American Association of Clinical Endocrinology and also the Academy of Nutrition and Dietetics. They talk about how to use diet intervention to treat type 2 diabetes in adults with a goal of remission. So what I mean by remission, their definition is, if you have type 2 diabetes, you should be HbA1c less than 6.5 for at least 3 months without using any surgery, without using any device, or even without using any medication for the purpose of lower the blood sugar, okay? Without any, no surgery, no device, no medicine, and want to reduce the HbA1c to less than 6.5 for at least 3 months. So they found out that later they give a conclusion, diet is a primary intervention of type 2 diabetes. They can achieve remission in many adults, okay? And actually it's related to the intensity of your intervention. So they have reviewed all types of medical journals, okay, some of the randomized control trial to some of the systemic review or meta-analysis, and they come up with a conclusion. And also they have come up with a statement, also say that they can produce remission of type 2 diabetes with a similar success to the bariatric surgery. We know that a lot of people with obesity, okay, they cannot reduce their weight. They go to bariatric surgery, and after the surgery over, the diabetes gone. So they want to compare the result and find that actually is similar effectiveness. So the conclusion is remission should be the clinical goal in any type 2 diabetes. That means when a diabetic patient comes to us, we are not thinking about how to reduce the complications some more. We're not only talking about how to manage and control, we're also thinking about the aim, how to do the remission, or some people use reverse, okay, of remission of diabetes. This is our primary goal. So how about high cholesterol? In high cholesterol, there are many journeys available. I quote one journal from a JAMA magazine. They talk about effectiveness of the diet versus statin medicine, lower statin. They compare side by side using diet or using drug, statin drug, and compare. And the conclusion same. They say diet could be as effective as statin in lowering cholesterol. It helps. It helps. That means diet first before we go for medication. It works. It works. So we do this further research in a normal baby. What is the normal cholesterol in normal baby? We talk about LDL. We call people bad cholesterol. Our lab test said 2.5 or 2.6. You look at the baby, they're less than 2. They're less than 2. Arteriosclerosis also, they did a study. The main blood thickening or blood blocking, it progressed, will continue to progress. They found that if your LDL less than 1.8, actually the arteriosclerosis does not progress. So now they found actually optimum LDL is not 2.5, it's less than 2 or less than 1.8. So same, total cholesterol is not less than 5.2, it should be less than 3.6 or LDL less than 1.8 in order to do all kind of reversal of chronic illnesses or reversal of so-called arteriosclerosis. Okay? And this is an example of one of the blood tests. Without any medication, total cholesterol can be 3.3 and LDL can be 1.31. It's achievable with just lifestyle modification. So an example is when we talk about coronary artery disease, means our blood vessel get blocked. Heart blood vessel get blocked. Huh? Okay. We know this is a very urgent thing in Malaysia. Instead, every day 50% die from CVD, cardiovascular disease. And there's a journal come up from the Lancet magazine or even JAMA magazine. Even a long time ago, they're using intensive lifestyle changes to reversal of coronary artery disease. They found that 1 year they do a study and 5 years they do a study. They did 5 years. The experimental group, that means they use lifestyle modification with no lipid, no cholesterol lowering medicine. They found that the blocking actually reduced by 7.9%. However, for those control group who are taking the no specific lifestyle modification and then they take the lipid lowering medication, they progress. They're even more blocked. So the difference is 36.5%. That's a lot. Now, how about if both groups also not taking any lipid lowering medication? The experiment group, they reduce 7.9% of blocking. However, control group even increased 46% of the blocking. The net difference is even 54.6%. So this is, you can look at the more detail in the article. You can see the graph, the two lines. The one getting lower and lower, that means the blocking is getting lower and lower. However, you're not doing intensive lifestyle changes, actually your blocking is getting higher and higher. They even did a study on those American soldiers who went for the Vietnam War last time, okay, died because of the war and sent back to United States to do post-mortem. They found that almost majority of the soldiers, they have heart block, some even up to 70%, even though they are physically fit and always on exercise. That means exercise is good, it's good. However, if you're not taking care of your food, you're in a problem. So same, they found that the more you follow, the more effectiveness it is. The more you follow, the more effective it is. So another update, there's another journey. They also update the 12 years experience of arrest or reversal treatment of coronary heart disease. Okay? They found that you can see on the left picture, there's a blocking in the blood vessel, and then after certain times later, they regress by 30%. This is another case, also same thing. In this case, is a surgeon who himself got the block in the heart blood vessel, and because the blocking is quite a lower part, so the stent cannot be done. So he has to be on a modified lifestyle modification and diet as well, even without any lipid lowering medication. And 36 months later, you can see the block is reversed without any stent or any surgery. So if you conclude all kind of article or research that mentioned to you, actually what is the type of diet pattern they use? What do they use actually, okay, to produce all kind of different good result? All the food they use, we call it whole food plant-based diet. But whole food plant-based diet, people always say, wait a minute. I've seen many people have vegetarian, have high cholesterol. We've seen many vegetarians have heart blood vessel blocking, diabetes, many. Are you sure it works? Because through my experience, it doesn't work. Because when we talk about whole food plant-based diet, one thing we always miss the key, the link, the key is whole food. When we talk about plant-based diet, we forgot there's one called whole food. Whole food means non-processed or minimally processed original food. Okay, we don't eat processed food, okay, or the biscuit or the flour. As long as the food, we all know that plant-based got lots of fiber. Now people even say that fiber is one of the most potent antioxidant fiber. Once you remove the fiber, you end up problem. So of course, what the diet without fiber? Meat without fiber, meat, fish without fiber. So they end up problem. Okay, we're not going to discuss further about what's the problem. Meat, there's a lot of problem. What are the plant without fiber? Plant without fiber is flour, processed white flour. They remove all the fiber. What else? They remove the fiber. Oil, they remove the fiber. Right? Olive with fiber. Olive oil without fiber. Peanut got fiber. Peanut oil, no fiber. And sugar, no fiber. And high salt, no fiber. You see? Once the plant things is so good, once you remove all the fiber, problem comes. That's how we observe so many people on vegetarian diet, they end up problem because they're not taking whole food. Whole food is the answer and the key. And we spend years and we found the reason why. So same, there's an effect of plant-based diet on blood pressure. It's a systemic review and meta-analysis. They also found that plant-based diet is associated with a significant reduction in the blood pressure compared to the omnivorous diet. Okay. So no matter how we do, say minimal meat, minimal oil, whatever, we call omnivorous diet, is still not as good as a plant-based diet in the reduction of blood pressure. So plant-based diet help those with type 2 diabetes lose weight, control cholesterol, and even improve the glucose control, and also reduce heart disease risk by 40%. However, people are always asking, but is it sustainable or not? Easy to say only, right? After that, can it sustain or not? So I always say that sustainment of lifestyle or sustainment in a diet modification is the same as exercise. Exercise is good, agree? Okay, agree? Is it sustainable? No, depends. If you think it's not sustainable, when patients come to you, do you still advise exercise? Even though you don't think it's sustainable, but you still advise. Why? Because you know exercise is good. So some can be sustained, some cannot sustain. But I still tell the truth to you and let you make the decision, right? Same as a diet. Many people have think that diet cannot be sustainable, so I'm not going to advise diet. No, we still advise diet. Some people able to sustain it. But to talk about in a more scientific way, they did a lot of study. They one called Complete Health Improvement Program. It's one of the most intensively researched health program in the whole world, run in many countries. Okay, they even assess the long-term effectiveness of this cheap program, lifestyle intervention program. They also use whole food lifestyle. They use whole food plant-based diet. And they found that for those who go to this program before, okay, about 1 month program only, they're able to maintain improvement in most biometric or most parameter in more than 3 years. Conclusion is, it's sustainable. So diet modification is effective and sustainable. We don't try, we never know. So I urge all the healthcare providers, please pass this truth to your patient and let them know that diet is important, but I'm not sure whether you can follow or not, but I will still advise you on plant-based, full food, plant-based diet, just like exercise. However, we also know that there's challenges. What are challenges? If a patient says, oh, okay, I want to try, but I don't know how to cook. You don't teach me. I'm a doctor, I'm a dietitian, or whatever. I can advise, but I don't know to teach you how to cook. Or they say, I have no time, always need to eat outside food. So how? We also want to try how to solve this problem. That's how we started a program called the Healthier Me 21-Day Challenge. This challenge actually is to eat 21 days of a whole food plant-based diet. Okay? Some people even 7 days also can see effect. 7 days, 14 to 21 days. Some people up to 30 days. We can do a blood test before and after. After means roughly day 14 to day 19. Day 14 you can see the effect already. Okay? Then you can compare before and after. So how we do the program, actually we have a group of volunteers, doctor, dietitian, nutritionists. We work together. We approach the restaurant. We teach the restaurant how to do it. So many restaurants actually do not know how to do it. We teach them how to do it. Okay? And then we see the menu, okay? We do a QC, we taste their food, everything okay, then only we launch this program. Okay? So this is some parts of the sample. Okay? It starts from a small town, considered a small place called Sedang in Malaysia. Okay? It's nearly 2 years. And now it's already spread to many regions and many countries, and participants about 9,000 people now. Okay? So these 9,000 people, we have make a lot of difference to the public members. Yes, there are people who have hypertension, 150/90, dropped to 112/72. Okay? We can sometimes issue the certificate as a motivation. We have cases of 21 days. The hypertension medicine have been reduced by half by their doctor, not by us, by their doctor. And then a few months later, they're totally off hypertensive medicine a few months later. There are many such cases. So we look at pre-hypertension, or even look at hypertension. So look at hypertension. We have 1,889 people who do the pre and post blood test. We found that they reduce 10% of blood pressure. If you have hypertension, you join this diet modification, 82% will see improvement in hypertension, and 62% will see their blood pressure back to normal level in 21 days. So same, we have people with blood sugar, high blood sugar, fasting blood sugar 7.1, despite of taking multiple medication, cannot control well. This is very common. Okay? And finally dropped to 4.8 in 21 days. So if you talk about pre-diabetic, even diabetes, look at the diabetes, they reduce the blood sugar average about 25%. That means if you have diabetes, your 97% chance your blood sugar will drop. And 77% of the participants with diabetes, actually, the blood sugar level back to normal. With this figure, what does it mean? Does it mean that actually 77% of the diabetic patient potentially actually they do not need any medication actually? Is it possible? Of course, this is not a detailed study. Okay, more study is needed. But it just tells us we need to think back, with lifestyle modification, just with just diet alone, okay, you can see 77% back to normal blood sugar level. So is it possible that maybe at least more than half of them actually do not need medicine at all, if you know that we intervene earlier with lifestyle modification? Same with those with high blood cholesterol. Okay, like this case is Mr. Tan. He's 54 years old with coronary artery disease, with high cholesterol, high triglycerides, and overweight. He has been taking multiple medications for past 13 years, and after he joined the program, and a few months later, his cardiologist managed to stop 3 medications and remain only 1 medication. He said this is the first time of his life he has to stop medication and only take 1 medication. So if you talk about weight, average drop about 2 to 3 kg, okay? Yes, total cholesterol. If you have high cholesterol, 98% chance you are dropping, and 79% chance actually after 21 days your cholesterol is back to normal level. Okay, even LDL the same thing, triglyceride the same thing. So of course, some people have more improvement than some other people. Like this case, this is a bit special case, 6.5 kg in 21 days. Okay, so there are many improvements. We make a lot of difference. Actually, all of you can make the same difference. Okay, all of you can make the same difference. Now this is a part of the sharing by one of the Malay couple. Okay, about what is the journey of a plant-based diet. Okay, can you on the video and see?
Hi, my name is Faisal, and I have an IT background, and I'm here together with my wife, Aina.
I'm Aina. I am trained as a veterinarian, but now I'm actually stay-at-home mom with 3 children. And when we had our first child, I allowed him to actually eat what other people were eating because I was not sure of the nutritional aspect. At about 3 to 4 years old, we saw that he was already having all sorts of health issues. He had eczema, he had respiratory issues. And in that year, we were in and out of the hospital like once every month. And that's when we decided to learn about health and wellness properly, to when we went whole foods plant-based. Basically, we have not had to go to the hospital for the past few years, except when he fell and he needed stitches. Every child is different, and each child will have the different genes as well. But if we were to compare him and the other 2 siblings, was the one who had all these issues, but the other 2 siblings have not had any respiratory or skin condition. We stayed with my father, although we ate all the plant-based foods, but he continued on eating his own foods. In 2019, he had a massive stroke. It blocked half of his right hemisphere of the brain. What he had, the stroke, was definitely due to his uncontrolled diabetes because he didn't want to do anything about it. The doctor already put him on 4 times insulin jabs per day, and he was on medication twice per day. We put him on a whole foods plant-based diet, minimal sugar, oil, and salt. 15.9 when he started, HbA1c. 2 months after being on whole food plant-based diet, the doctors could remove his insulin, all. And the doctor says, okay, let's just continue with his tablet medication. And within 6 months, they took him off all diabetic medication because his HbA1c already went down to about 5 to 6. And now it has been 3 years since he has been on whole food plant-based, and his HbA1c has been about 5.
To all those out there, because we know that a lot of people are suffering, but they do not have a solution and an answer. And we know and we truly believe that this can be a way for everyone to achieve better health overall. And not only that, they also contributing back to the environment and to the planet and for the future generations as well.
Injet Faisal and Aina, actually, they are not a healthcare professional like us.
Hi, my name is Faisal, and I have an IT background.
Yeah, I know you're Faisal. Okay. So Faisal and Aina, okay. So they see the improvement themselves. They suffer the whole process. They've gone through it, and they want to help more people. So Faisal actually works in the IT department in one of the listed company. And he's going to out of this company. He's going to join an NGO called ProVeg. Okay, it's an international NGO to promote plant-based diet from Germany. Okay. Tomorrow they are coming. Okay, so you have a chance. Invite all your friends. For those who didn't register, never mind. Just ask them to bring them to come. Okay, they might want to give a short sessions about what the activity they are doing. Okay, so there are many such people who are not medical based, but because they've gone through it and they see the success, so they volunteer themselves and to serve. So how about doctors? What the view? For those doctors, I know that not many people believe it. Let me quote Dr. Lim Nui Jun. I think she's here. I have been practicing medicine for 20 years. It's the first time that I have ever witnessed the great improvement in 21 days. Not just one parameter, but all the parameters. Because she helped us to analyze all the blood test results and how she got surprised of the improvement in the blood test. So actually it's nothing special after some time, because actually already there's a lot of research article already mentioned. Even they mentioned that a plant-based diet improve blood sugar, body weight, blood pressure, and cholesterol all at the same time. All at the same time, something no drug can do, okay? Drug can help a lot of different conditions, but there's no drug can cure or can control all these different situations at the same time. And I would like to quote Dr. Wong Tek Wee. Dr. Wong Tek Wee is also here. He's a cardiologist. He told me, I was very skeptical on the effect of the plant-based diet program initially. I thought a few months later, this program would die off. Impossible. Until I look at the blood test result and the data, and I'm convinced now. And he now is a true believer, and he's approving whole plant-based diet to many public members, even to his patient. Of course, we have a lot of different doctors throughout the whole world, even Malaysia. We have experience themselves of this diet program. They eat themselves because the food, you can choose to cook yourself, you can choose to let the food to deliver to your hospital, to your clinic is not an issue at all. Lunch and dinner, that's all, okay? So the geriatrician try, pathologist try, even there's Prof. Soy, orthopedic surgeon from UMC, also try it, okay? I think it's honor today, Professor Soy, also here in the hall, okay? So I would like to invite Prof. Soy to give a short sharing about his experience of this whole food plant-based diet. Professor?
Thank you, Dr. Eddie. I have been having high blood cholesterol for many years, close to 20 years. Now, we tried a few types of medications, not able to change it significantly. So after a few years, a thought comes in, then there is such thing called genetic, genetic run in the family, and it's easy to blame genetic because you cannot do anything about it, you're born with it. So it goes on quietly for many years until January of 2020, when COVID is starting to develop. One morning, I developed chest pain here on this side. So went to the casualty, checked and see, and then it was an angiogram, showed a single vessel block, and it's quite significant block, contributed to this pain. So stenting was done, and the symptoms never developed so far. But then I have a second thought about this cholesterol thing. I do definitely have a block now. So at that time, 2020 onwards, so with a cardiologist, I started anti-cholesterol seriously again. And I also try to modify the diet, take a low protein, that means a low meat diet, plus this anti-cholesterol. So over that 1 year, 2020, managed to bring we look at the parameter, the LDL, so bring it down to just below 2, which is 1.8, below 2, within the normal limit of healthy individuals. But the cardiologist told me, for a normal person, probably is good. But when you already have atherosclerosis, the target should be even lower. You should get about 1.5. But for 12 months I tried, were not able to get below that. So January 2021, before Chinese New Year, we were seriously talking about more serious form of treatment for cholesterol, including injectable form, after the Chinese New Year. Now, at that time, this Dr. Eddie tell me, hey, they are trying this 21-day veggie diet, the trial. Want to join or not? I said, no harm, because after that Chinese New Year, we can have revenge, reunion, can eat. Okay, 21 days, just take it, sign up. And we have a pre-test, blood test, and then after. So this is a whole food plant-based diet. Okay, I take it. It actually prepared lunch and dinner for us. Breakfast, we arrange on our own, but there is strict guidelines. Again, it is basically a plant-based diet. So the second test was taken not 3 weeks. In fact, after 2 weeks only, day 14, take a blood test. So as usual, the one pre-op, it is about below 1.8, 1.9 LDL. But after that, my target 1.5, and the blood test I got is 0.9. I never had this level before in my life. So that changed the myth about gene. Genetic is easy for us to blame. So I've been actually, after that, Chinese New Year, revenge, put it aside. We have been, in fact, Chinese New Year reunion year is always a revenge, right? Once a year, right? So we have been doing it for the close to 50 over years. So now it's time to change. It's for our health. So from there onwards, it is not difficult. I just directly convert into a vegetarian diet until now. It's already near to 2 years. For medicine, we always we think about evidence. Yeah, everything we talk about evidence. So association between atherosclerosis and cholesterol level and the diet, there are many evidence there. But it's easy for us to sometimes select the evidence we want to hear. Yeah, one thing is genetic. It is gene, that means you cannot do anything about it. But sometimes when you have this evidence in front of you, pre, post, you see, it is for you. So I know that it is my fault, it's the diet that I take, not the gene. So it is not a problem anymore. So maybe you all may want to consider this as well. Just take and see for your body, whether the diet do make a difference or not, whether it can make your blood level of cholesterol lower or not. That, I think, is one thing you can try for yourself. Yeah. So that's what I want to share with you all. Thank you.
Thank you, Prof. Soik, for inspiring sharing about his personal journey. I think many of you never attend any medical conference when the speaker talk about themselves. They only talk about others, right? Other research, other article, other cases, case study, others. And no one actually brave enough to share their own problem. We all know that this is a closed room. We all know we healthcare professional, we also suffer from fall high, right? We also suffer from high. But it's just that we never tell people we suffer from high because we want to treat people and we don't want to let people we have our own problem. But in fact, we have our own problem. And I would like to thank Prof. Soik. He's willing to give away and tell people his problem. Okay, and I think the reason is he wants to inspire more people and let more people know that there is a key missing link. Actually, we can kind of find back the missing link. Okay, so there's another study also help for those who get COVID. They want to see there are 3,000 over healthcare professionals who get COVID. They want to find who get more serious COVID, who get less serious COVID when they get COVID. Okay. And this study actually conducted with a healthcare professional from US, Canada, Germany, France, all developed countries. So the data basically should be reliable. Should be reliable. They found that for those who are taking plant-based diet, there's 73% chances, lower chances to get moderate to severe COVID-19, okay, compared to those who are not taking plant-based diet. Then they did a study, the same study will show that for those who like low carbo, high protein diet, people say low carbo, good high protein diet, means basically it's meat-based, okay? They have 3.86 times, almost 4 times greater chance to get serious COVID compared to plant-based diet. So more and more evidence found that if a diet is good, you should good in many different aspects. You'll hardly find a diet which is good for this condition but harmful, okay, many harmful to other conditions. You say, no, this is not a good diet. A good diet, you find that is good for one condition. Hey, this condition is good, this also good, this also good. Now, this is what we call supposed to be a human food, okay? So same, if you're talking about living with COVID-19, okay, now people always say living with COVID-19. How to live with COVID-19? We never had true guidelines to COVID-19. We just wear masks, avoid them. No, this is avoid COVID-19. We're not living together with COVID-19. So my definition of living COVID-19 is if you have chronic illnesses, at least try to prevent it, control it, or for those who have it, try to reverse it if possible. Okay? Plus, vaccination, yes, very important. Also, your diet, in order to, in case if you get COVID, also reduce the risk of getting serious COVID. This, we call it living with COVID-19 together. Okay. So for those who do not have all these conditions, we always must think of our future. What is our future? We always must think how we spent our last 10 years in our life. Okay. the many ways we can spend our last 10 years of life is our option, okay, on the video and see.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
See, sometimes it's hard to live longer is good, but live longer with the past 10 years in sickness is terrible. Some people say I'd rather die earlier, right? Okay. So call for action. Must always call for action. So if you, your clinic or your institutions are interested about this program, let us know. We'll pass you the whole program in details and how to do it. We can help you even implement the program in your institution. If you think that, I'm too tired, I'm too difficult to do this, but I'm interested in the program, then we can implement the program in the institution by helping you by delivering the food to your institution. It's not a problem at all. You just register. So this is the thing you can do to help yourself, your community, even your colleague, or even your patient. Plus, if you're interested, you can join our program and experience yourself. You can do a pre and post test to do it, okay? Because to believe it is to experience it yourself, okay? We're welcome to experience it, okay? It's not an issue at all, because we all know that whole food plant-based diet, we can save approximately 1 trillion per year in healthcare costs, and so cut food-related emission, carbon emission by 70%. So now there's a statement that the future of healthcare is not only develop advanced medicine or advanced procedure. The future of healthcare is plant-based diet as well. Okay. It's a time to U-turn, to re-look back on our original guideline or the original means in our medical school. When of course chronic illnesses, the first line of treatment is lifestyle and diet modification. Okay. We hope that all of you have get this information, try to explain yourself, register, we'll teach you how to register. And tomorrow we have another session, more detail about what is this program about. That presentation will be announced to the whole world, how we're going to do it, and hope all you can join it. And please invite friends to come together if they're interested. Thank you very much.